Healthcare is a team sport, and collaboration between physicians, hospitals, industry, and governments is critical. I'm here in London at the Charing Cross Medical Conference, a leading endovascular meeting, bringing together thousands of experts from around the world. And I had the pleasure of talking with Lord Stephen Greenhalgh. He's the director of Biba Medical. They put together this innovative vascular conference every year, and he comes with a very unique perspective. Stephen also sits here in government. He's a member of the British Parliament, the House of Lords, which I had the good fortune to recently visit. He literally sits at the intersection of healthcare and government.
Lovely to see you, Atul.
Yeah, and
welcome to my city.
If you could put Charing Cross in a sentence or two. I know the theme is always around where evidence, innovation, and education come together.
This is a community. It's a global vascular community interested in the optimum management of the patient, and that requires industry, companies like Philips that contribute great innovation, working together with the leading physicians to deliver optimal care for the patient, and that can only happen through that unique partnership.
Problems I hear about: increasing access to care, lengthy delays for care, staff satisfaction, physicians, nurses, technologists quitting in droves, accelerated by COVID. We need to sort of fix all of that. Do you think technology has a role? How do you think technology would have a role?
I mean, technology definitely has a role, and what you're pointing to is that you can't deliver healthcare without motivated individuals, and there are too many stories of, I think they call it burnout, and people demotivated, and we have to recognize that we need to create an environment where people can grow and enjoy what they do.
And minimally invasive procedures specifically, I think they do have a role in terms of increasing access to care. Certainly procedures can be done faster, maybe even better than with open surgical procedures. So do you see a role 5 years from now in minimally invasive procedures expanding in the UK?
Well, it's going to happen not just in the UK, but globally. I think now with minimally invasive, it reduces the blood loss. The patient literally gets a significant correction, but is out of the hospital the next day. That's got to be good for the patient.
With just a Band-Aid on the wrist or the groin.
Absolutely. So this is the era, the next era. But I have to say that it won't stop there.
I spent some time at St. Thomas's yesterday, and I talked to administrators and physicians, and they were telling me that it's very important for a physician voice to be brought into Parliament. How do you see your role in the House of Lords bringing in the voice of a physician?
Well, I always talk about the three Ps. It's very important that policymakers meet the physician communities, but also that we meet the payers, that ultimately we're talking about taxpayer money, and also hear the patient voice. I mean, the patient's got to have a good experience. If you get those four Ps together, then you're going to go in the right direction.
And now, you're in the know.